Welcome to This Explainer. Right off the bat, we're tackling a topic today that needs a mix of deep empathy and, honestly, absolute clarity. We're looking at the role of sound therapy and ASMR in cancer care. Now, let's be clear. Sound absolutely belongs in cancer care. You know, things like music, calming audio, guided relaxation, they all have a truly vital place for anyone navigating treatment. But as we dig into the sources and the research today, we have to describe its role with complete, unvarnished honesty. Sound does not cure cancer, period.
Now, what's really interesting about this is that often when we draw strict medical boundaries, it can kind of feel dismissive, right, or overly clinical. But this quote reorients our perspective perfectly. That boundary is not cold, it is caring. People facing cancer deserve immense, boundless comfort, absolutely. But they also deserve the truth. Blurring the lines between real medical treatment and supportive comfort helps literally no one.
So, to give our nervous system something safe and predictable to follow, here is our roadmap for today. 1. Comfort in cancer care. 2. The science of sound. 3. ASMR as supportive care. 4. Boundaries, support versus cure. And finally 5. Creating your comfort playlist.
Let's start with Section 1. Comfort in cancer care, the sensory experience of medical stress.
Think about the everyday reality of oncology care for a second. It's deeply overwhelming. You've got crowded waiting rooms, the loud, jarring hum of MRI scans, those incredibly long hours hooked up for infusions, add in the harsh hospital lighting, the unpredictable side effects, and just the sheer, heavy weight of uncertainty. This constant barrage of medical stress leaves a patient's nervous system feeling like it's constantly on high alert. It's an environment where, frankly, you're often told where to sit, what to wear, what's happening to your body next, and that can feel incredibly disempowering.
And that brings us to the real power of audio. Sound can actually become this small, safe island of control in an otherwise uncontrollable situation. The most important part of this entire sensory experience is choice. You choose the voice, you choose the volume, you choose the specific trigger, you choose exactly when to hit pause. It returns that much-needed autonomy right back to the patient. You get to dictate at least one aspect of your environment, and wow, that is just profoundly comforting.
Okay, let's dive into this next part. Section 2. The science of sound. Clinical evidence for music therapy.
So in actual clinical settings, music therapy is a fully recognized part of supportive care. We're talking about trained music therapists working to help patients manage some very specific, really tough challenges. And the proven benefits are amazing. Anxiety reduction, which is absolutely crucial before a difficult treatment, pain management, fatigue support, getting some much-needed sleep comfort, and an overall improvement in mood and quality of life. These are highly specific, targeted interventions meant to help patients cope and process some really heavy emotions. Let's look a little closer at the data backing this all up. Systematic reviews consistently report real benefits across the board for anxiety, pain, fatigue, and mood. To put that into perspective, a 2024 review published in Scientific Reports focusing specifically on breast cancer patients found improved anxiety and depression outcomes. Now, the researchers rightly noted study limitations, as all good, honest science does, right? But furthermore, oncology nursing summaries describe positive effects not just on mood, but actually on patients' vital signs. It's robust, supportive data that really shows the so what of why this matters.
Moving right along to Section 3, ASMR as supportive care, bridging clinical therapy and self-directed comfort.
First things first, we absolutely must separate these two terms so there is zero confusion. Music therapy is clinical care. It's administered by a trained professional in a formal healthcare setting. ASMR, on the other hand, that is self-directed comfort. It's based on specific audiovisual triggers, think a soft voice, personal attention, gentle sounds, slow pacing. Basically, one is a professional oncology discipline and the other is highly accessible, trigger-based audio relaxation that you control yourself on your own device.
Now, while ASMR-specific cancer research is admittedly a bit limited right now, our sources point out that ASMR shares many of the exact same supportive mechanisms as music therapy. Think about it. A calm voice naturally dials down emotional urgency. Predictable, repetitive sounds give your mind a safe focal point, kind of distracting you from medical anxiety. The illusion of personal attention in ASMR videos can dramatically ease the crushing loneliness of a hospital stay. And gentle bedtime ASMR, it is an incredible tool for aiding sleep that's been thrown totally out of whack by treatment stress.
Which brings us to a really important discussion in Section 4. Boundaries, support versus cure. Drawing the line between comfort and medicine.
And this brilliantly illustrates what is arguably the most crucial distinction we have to maintain today. On side A, we have supportive care, anxiety relief, sleep comfort, mood support.
On side B, we have medical treatment, chemotherapy, radiation, surgery, immunotherapy. Sound therapy lives entirely, 100% on side A. It is a powerful, helpful tool for the mind and the nervous system, sure, but it has absolutely no place attempting to replace the actual medical treatments required to fight cancer over on side B. Because of this, it is vital to be cautious out there. You should actively avoid wellness content creators who sell these crazy miracle claims, implying that sound can actually treat cancer. It's dangerous and it's completely unsupported by science. Actually, scratch that, it gets even worse. You have this predatory guilt-based language some of them use, literally telling patients they failed to heal because they didn't vibrate correctly or didn't listen to the right frequencies. No way. The best sound support is humble. It never blames the patient, and it never, ever oversteps its bounds.
Comfort is not a cure, but comfort still matters. That's the main takeaway here. Sound should never be the treatment plan. It's merely a compassionate companion beside the treatment plan. It essentially says to the patient, your fear deserves gentleness, and this audio might help you feel a little calmer while your real clinical care does the heavy lifting.
Let's get practical with Section 5. Creating your comfort playlist, empowered support for you or a loved one.
Utilizing sound therapy effectively really boils down to following 3 simple steps. Number 1, keep it simple. Seriously, don't overcomplicate the tech or the choices when you're already stressed. 2, keep it safe. Use a comfortable volume to protect your hearing. And 3, and this is absolutely paramount, always ask your oncology care team about any restrictions during procedures. Your medical team needs to be in the loop to ensure your headphones or devices don't accidentally interfere with your care. When you're building this playlist, consider some of these highly accessible audio options. Soft music, the steady, grounding ambience of nature, gentle ASMR triggers, guided breathing exercises, or honestly, even just recordings of a trusted loved one's voice. Curating these sounds on your own device allows you to reclaim that small island of control we talked about earlier. You press play when you need it, you press pause when you're done.
Well, we've covered a lot of ground. We've seen how clinical data supports the use of sound to ease anxiety and pain, and how ASMR can serve as a really powerful, self-directed comfort tool, as long as we respect that caring boundary between supportive comfort and actual medical cure. So I want to end this explainer by honoring your autonomy with a question, something to really chew on. What sound feels most comforting to you during moments of deep medical stress? Is it music, the sounds of nature, a soft, familiar voice, or perhaps is it just the profound comfort of silence? Thank you so much